Doctor, we talked about digestion a little while ago. What is Candida, and what are some of the things that that condition can lead to?
Well, there are many infections that are part of what we deal with in the environment. Candida would be one of the most common fungal infections that our body has to contend with. And there's no test for it, and that's why in medicine it seems to take the approach that, well, the test is normal, so there's nothing wrong. It reminds me of, I have 5 kids that I had, and when they were little, you do this thing, you're invisible now because I can't see you. And in medicine, we have the same thing. If I can't do a test for it, it doesn't exist. That's what's happening with Candida. Candida overgrowth, and we know about Candida from vaginal infections, people hear about that, but the main Candida problems are in the gut and the sinuses. So what happens is in the bowel, especially when you have a lot of sugar, because yeast grow by fermenting sugar, and if you think about the average 48 ounce, one of those big burp sodas you get at the Quickie Mart, well, that has 36 spoons of sugar in that 48 ounces. So people take that and they chug that. They've got a little fermentation tank going on in their gut. And what happens is the yeast are growing and making baby yeasties. And then people take antibiotics and it kills off the healthy bacteria, which is what keeps the yeast in check. And now they are partying. So how do you tell if you have Candida if the test isn't there to tell you? Nasal congestion, sinusitis, postnasal drip, spastic colon. If you get irritable bowel syndrome, gas, bloating, diarrhea, constipation, irritable bowel syndrome or spastic colon, that's your doctor's way of saying you have gas, bloating, diarrhea, constipation, we don't know why. But we don't want to say we don't know why because then we feel stupid, so we put a name on, oh, you have irritable bowel syndrome. Instead of taking the time to look to see what's actually causing it. So infections such as Candida would be the #1 thing causing it. Parasites can do it, food allergies, a host of things. The other thing is that the Candida in the gut will cause swelling in the nasal passages. And what happens is you get nasal congestion, it swells the sinuses shut, and anytime you block anywhere in the body, be it the gallbladder, the regular bladder, the appendix, it will get infected. So now you get a secondary bacterial infection, it turns yellow-green. What does your doctor do? Throws an antibiotic. You feel a little better sometimes. In the first couple of days, the yellow-green goes away. But what do antibiotics do to yeast infections? As any woman can tell you who's had them, yeast infections gone